Geographic distance, a limited range of services, hospital downsizing, and cultural differences have created barriers to accessing health services. Today I'm speaking with Dr. Rick Titus, who is co-founder of Banty, a new patient-centric video conferencing platform aimed to elevate appointment backlog in the healthcare system. Good morning, Dr. Titus. How are you today?
A great, Colette. This is a great day. The vaccines are coming. We can see the light at the end of the tunnel. So I'm really excited.
I agree with you. Today is a wonderful day, and it's even more wonderful knowing that you're in my hometown of Hamilton. So, as I'm feeling very homesick during this pandemic, so I can't go back and see my family, I'm really happy to be speaking with you today. So, let's get right into it. Why don't you tell me a little bit about Banty.com, how it was launched, how it came about?
Well, the reason that we launched Banty, actually, we've launched it 2 years before the pandemic. And the reason is that the patients really like this connectivity. Hey, I want to see my doctor. I want to speak to my doctor virtually. So I've got patients all over the north. I've got patients. I used to practice in Blind River. I still have patients in Blind River. And so they would say, hey, it's a long trek just to come and see me. Not that they don't mind, but hey, why don't we develop a video platform where they can just see me on a video platform? It's like medical Skype.
Yes, it is, yeah. So tell me then, how would a patient, to walk me through a patient and physician interaction?
Okay, so it's one of the great things about Banty. It's really easy. So I have a Banty address. It's like an email. So my Banty address is banty.com/Dr. Titus.
Okay.
So that's my address. So if I have a patient, let's say you have a 10 o'clock appointment. So the patient says, okay, at 10 o'clock, they put that URL in. That's banty.com/Dr. Titus. And they're there.
Okay.
And they don't have to put any passwords. Nothing else is required. And then they go into my waiting room and they know they're in the right place because it's my waiting room. There's a picture of me. There's a picture of our staff.
Okay.
There's information about diabetes. So it's really cool. And then my nurse will take them from the waiting room to the virtual exam room, and she'll get all the history on all the information. And then I'll come in and I'll see them. Easy.
Okay, very easy. So, just on that, do you specialize in a certain area? Who are your patients?
Well, so sort of my interest, I'm a family doc, associate professor at McMaster here.
Okay.
But my area of interest is obesity. Actually, I wrote the chapter in the new obesity guidelines talking about video platforms and using emerging technology in the management of obesity.
Well, congratulations. That's
Thanks.
incredible. So let's talk a little bit about virtual medicine. Now, as I was discussing with you before the interview, coming from Hamilton and moving here, I had to give up my family doctor. I'm still on a very long waiting list for a family doctor. Sometimes, it's okay for me, but having two sons, it does cause some stress sometimes, and we do have to go to the hospitals to get a prescription refilled and whatnot. So that's taking up a space of someone, in my opinion, who really needs emergency care. So how is virtual medicine helping alleviate the high demand for care on a variety of levels for those living? Let's just talk about northern parts of Canada, if you can.
Well, Colette, you can come and see me.
Okay.
So a case in point, I have one of my patients. She's been my patient for decades, and she's moving to Richards Landing. She moved to Richards Landing, and she says, hey, Doc, can I still see you? Because, I can't find a doctor there. You've been with me for 20 years. It would be so much easier for me. And I said, yeah, not a problem. So now I see her on Banty. And if she needs an appointment, she makes an appointment and we see her virtually and I can address all her concerns. And it's so convenient for her because she can even see me on her smartphone. So the last time I saw her, she's working and it was like 11 o'clock and her appointment is, and she says, hey, just let me step away somewhere where we can speak in confidence and quiet. And so she missed no time off work.
That's great.
She was able to see me in Hamilton and I was able to deal with all her issues. I got prescriptions sent up to her pharmacy in Richards Landing. Easy.
Oh, that's great. So let me just ask you one more question on that. So yes, you have the waiting room on banty.com/Dr. Titus. Now, how do I first become a patient of yours? Would I go to banty.com, or is there another form of communication in which I need to connect with you?
Yeah, so you can just go online and say, hey, I want to become a patient of yours.
Okay.
And so then we there's a questionnaire we fill out, then we see you on your first visit on Banty, and we go through your history. So it's an easy process, it's a virtual process.
Okay.
And I think that's where medicine is going.
Yeah.
It's engaging with all these new technologies.
Yeah, I appreciate that, and I do agree with you. I think even that the fact that where someone doesn't have to miss work, it's easier on the employer as well as the employee, and it's a fabulous, fabulous system you've developed. So let's just talk quickly about the pandemic and how it's completely transformed the healthcare industry to cater to patients. Banty has risen to play a number of critical roles during the pandemic. Do you want to elaborate on that a little bit further?
Well, yeah, for sure. I think in the past, because of the pandemic, we've accelerated. So, for example, the adoption of electronic medical records took 6 years. When it comes to adoption of video medicine, virtual medicine,
Okay.
we were able to do that in 6 weeks. Now, if you ask the doctors, 80% of the doctors are using some form of virtual medicine, albeit many are using phone. I think it's time we stretch and go to the next step and of using video, because video is so much more wholesome and you get a really great appreciation of what's happening with your patient, and your patient gets to see you, and
Yes.
it's a great interaction.
Two-way communication, I feel, is extremely important. I mean, I know we had the telehealth help, the telephone line, which I did use several times when my kids were younger and babies, but the panic of a young mother. But it is nice to have a two-way communication and visually to see the doctor that you're speaking with. So hats off to you for creating such an exciting platform. Now, can you just share with us if there's an email address, or again, if you want to share your website or your URL so that we can get that information out there?
Yeah, so it's Banty.com, and you can actually go to Banty.org if you want to find out more information.
Okay.
And one of the great things about our particular platform is that it's really suited for the North, because our platform, you can dial down the bandwidth. So if
Oh,
you're
great.
talking to someone and they got great bandwidth, well, you're in high def. But you can dial it down to standard def, low def, and if all else fails, you can actually go to audio, so you never
Okay.
lose a call.
That's an extremely important point that you've highlighted. Bandwidth connectivity is an issue here in the North. So I appreciate you recognizing that. And I appreciate you taking the time with me today, all the way from my hometown in Hamilton.
Well, the hammer misses you.
Oh, and I missed the hammer. You take care, Dr. Titus. Thank you very much for today's interview.